Hello friends, welcome back to ultrasound teaching videos with Dr. Arshad Nadeem Awan. Hope you're all okay, you're all enjoying your life, you're also enjoying my videos and practicing ultrasounds as well. This actually I have to say regularly because of the fact sometime if some of the person who start away jump into one of the or bump into one of my video, so at least he should know who am I and what is this channel about. So that's why and those who are regularly watching this video, so I would say apologies, and because this what we have to say all these things as a proper pattern. Today my topic of discussion is adenomyosis. Adenomyosis is a benign condition. It is not the malignant condition. And what happens in adenomyosis, the endometrial glands and endometrial stroma, it started embedding within the myometrium. So this is called as adenomyosis. And so far the histology is concerned, there is a criteria. It should have been 2.5 millimeter to 3 millimeter away from the outer edge of the endometrium. This is called as adenomyosis on the histology. So far the symptoms and signs are concerned, sign we can see on the ultrasonography, but so far the symptoms are concerned, the patient give rise to a vaginal bleeding, dysfunctional uterine bleeding, and sometimes pain during the menses, dysmenorrhea, menorrhagia, and beside this it also accounts for infertility. So this is what all the adenomyosis is, which is very easy to identify on the ultrasonography. On the ultrasound there are certain features. You can pick these features and you can label the case as adenomyosis, but mind you, there are different patterns. There may be diffuse adenomyosis, entire area, entire uterus would be involved, or there might be focal adenomyosis which mimic as a fibroid, but actually this would not be fibroid, this would be focal adenomyosis. The another pattern, sometime it will appear as a large cyst, so that would be called as a cystic adenomyosis or cystic adenomyoma, or in other word there is a particular word used for that, juvenile cystic adenomyoma. So juvenile cystic adenomyoma is another condition. You have to differentiate between the uterine simple cyst and the juvenile cystic adenomyomas. There are certain criteria. If you are looking, you can differentiate between the adenomyoma and leiomyoma, focal adenomyoma and leiomyoma. So mind you, the adenomyoma will not be having a distinct outline, and in the fibroid or leiomyoma there will be a distinct outline outer capsule. So through this you can differentiate whether it is fibroid or it is adenomyoma. The second differentiating or distinguishing point is, in the fibroid there will be central vascularity, while in the adenomyoma there will be peripheral vascularity. So these two are the features. I am sure you will be very careful when you want to diagnose or label the case as adenomyosis. Another important point is you must pay attention while the patient is on tamoxifen. Tamoxifen is a medication used for the breast cancer. So those who are taking tamoxifen, you must be very careful for the uterine presentation. For the adenomyosis, there is likely chance of adenomyosis. So how it will appear on the images, what are the images findings and characteristics? Let's start watching these videos, and I'm sure you will be able to pick all these points very easily. So start watching these images.
This is transvaginal scan, and on TVS scan you can see the uterus is clearly visible. In the center, endometrial thickening can easily be seen, but on the superior and inferior part of the endometrium, these indicated by the white arrow, you can see a round echogenic area. This is actually endometrial deposits within the myometrium. So this is the example of the adenomyosis. In the inferior aspect indicated by the white arrow, it's slightly striation, which is again endometrial deposits within the myometrium. So this is an example of the adenomyosis. So adenomyosis may occur in this form, if it is 2.5 to 3 millimeter away from the endometrium, so you may label it as an adenomyosis. As I have told you, adenomyosis has multiple patterns and appearances on the ultrasound imaging. So this is one of the appearance of the adenomyosis. Actually, these both echogenic foci indicated by the white arrow are actually endometrial deposits within the myometrium. So whenever there is endometrial deposits within the myometrial area, that would be called as an adenomyosis. So this is a picture of adenomyosis. On this transvaginal scan, this is another example of the adenomyosis, but the pattern is different. Here you can see tiny cystic lesions or tiny small cysts within the parenchyma of the myometrium. So multiple cysts can be seen. This is another example of adenomyosis. So adenomyosis may appear in this form. You can see these small cystic appearances within the myometrium. If you come across any cystic appearances within the myometrium, that would be due to endometrial deposits within the myometrium. So this is another example and another pattern of adenomyosis. So you have seen echogenic foci, echogenic striation, and this is another example of small cystic spaces within the myometrium. Again, I would mention the criteria that it should have been 2.5 to 3 millimeter away from the myometrio-endometrial interface, which you can appreciate here. Endometrium is in the center, echogenic endometrium, and it shows secretory phase changes, but myometrium shows small multiple cystic spaces because of endometrial deposits, and this is example of adenomyosis. On this third transvaginal scan, you can see another picture, another form of adenomyosis. In this status, if the myometrium becomes heterogeneous, as you can see on this image, it is diffusely heterogeneous myometrium. So diffuse heterogeneity of myometrium suggests adenomyosis. So this is another example. Many a time clinician write that there is heterogeneous myometrium suggestive of ill-defined fibroid activity, which is also right, because you cannot differentiate fibroid many a time, and because of its ill-defined margins. But the second possibility and the differential would be adenomyosis. If you cannot see any outline or there is no visible outline as we can see in the fibroid, then there is likely possibility of adenomyosis. So on this image, it is clear that heterogeneous myometrium can lead towards the diagnosis of adenomyosis, because there is no leiomyoma, there is no fibroid activity can be seen. So this is another example of the adenomyosis. So you have seen echogenic foci, echogenic striation. This would be the one pattern. Another pattern is small cystic areas within the myometrial parenchyma. The second one, and the third thing is the third point is when there is heterogeneous myometrium itself. So this would be considered as adenomyosis. The fourth ultrasonic feature for the adenomyosis is globular shape uterus. Many a time you come across with globular shape uterus. You cannot make a head or tail of it, which way we should look for the fundal region or how it will look while the lower uterine body is concerned. So it just look like a globular and round shape uterus. If you come across with globular shape uterus, you may consider adenomyosis. Although this is a very rare entity, but still you will see on the ultrasound imaging. So the fourth form is globular shaped uterus. So echogenic striation is the first form. The second, you will see small cystic areas within the myometrium, and if the myometrium appears heterogeneous altogether, so this would be adenomyosis. And if the shape of the uterus appears globular, so still it is adenomyosis. So here is the fifth and the last point, and that is asymmetrical myometrial thickening. Look here on this image, the superior margin, the superior myometrium or anterior part of the myometrium is thinner than the posterior wall. Here the posterior wall is much more thicker than the anterior wall. Endometrial lining is visible. It seems like it's in early proliferative phase. superior in myometrium is very thin, while posterior wall of the uterus, posterior myometrium is very thick. So this thickness, this asymmetry of the myometrial thickening, suggestive of adenomyosis. So all these 4 points has been discussed on these images, so I will just repeat it for you again. So if you come across any striation or nodular pattern 2.5 to 3 millimeter away from the endometriomyometrial interface, you may consider the adenomyosis. If you see multiple small cystic areas within the myometrium, so again think of adenomyosis. If myometrial pattern appears heterogeneous, so this would be due to adenomyosis. If the uterus shapes look like globular, so adenomyosis can be taken into account. And if there is asymmetrical myometrium, so again the adenomyosis would be the diagnosis.
Yes, friend, this was all about adenomyosis. I'm pretty sure that this time you will be able to understand clearly what adenomyosis is or what is focal adenomyoma, and at what stage we will label it either as a focal adenomyosis or focal adenomyoma or diffuse adenomyosis. When the endometrial stroma and glands started implanting within the myometrium, that condition is called as adenomyosis. I have discussed all features at length, how it will appear on the ultrasound imaging, how we will differentiate it from leiomyoma and adenomyoma, how we will appreciate juvenile, cystic, adenomyoma. So all these features has been already discussed. If you have any question or any query regarding this topic, just drop me a message and I will try to get back to you. Beside this, I would say here, keep watching my videos, and with new topic in the next video. I will see you again. Till then, take great care of yourself. Bye bye.